Welcome back, everyone. We are tackling your questions about the vaccine. We know there are many, and we have Governor Lamont with us. We're also now joined by Acting Commissioner of the Connecticut Department of Public Health, Dr. Deirdre Gifford. Thank you so much for both of you for being here. And Doctor, thank you for joining us as well.
Thanks for having me, Kara.
You know, we really want to clear things up for people in our time together. The majority of questions that we have received are from people wanting to know when. When can they get the vaccine? When is it their turn? So we do want to start with the teachers. The first question I have is a public school teacher named Cynthia called, and she says she's in school nearly every day this school year, and she would like to know why teachers in Connecticut have not moved up the vaccine line. Other states are vaccinating teachers. She says teachers are called essential workers, but they keep moving down on the list of people getting vaccinated. Governor and Doctor?
Take the lead, Deirdre.
Sure. Well, first of all, we are very grateful to all of our frontline essential workers, teachers, daycare workers included. And it's been so important for our students in Connecticut for their physical and mental health to be back in school. So very grateful to our teachers. Teachers and other frontline workers are in the next group to be vaccinated. It was a very large group, this phase we're in, so-called phase 1B. So we've needed to phase it in a little bit slowly because we simply didn't have enough vaccine to do everybody at the same time. So after we're doing the 65 and older, we'll be opening up to the frontline essential workers,
Which then would include the teachers with them. So our next question, another common one. This comes from Vanessa. She wants to know when people over 65 will be able to get their shots. Governor, you want to update everyone? I know you addressed it a little bit in the beginning of the program.
Well, on a personal basis, I'm kind of interested in that date as well. Deirdre tells me we've got a pretty good flow of vaccines. We've got well over 50% of our 75-year-olds vaccinated already. So I think within 10 days or so, we can give pretty clear guidance on when 65-year-olds can start signing up.
Okay, that's great. And building off Vanessa's question, John in Suffield, he has a birthday coming up in March. He will be 65. He wants to know if he can sign up before he turns 65 for an appointment after his birthday. He wants to get a jump on things. And we've also had another question about why can't people who are in the 65 to 74 age group sign up for appointments in March or April when that phase of 1B is expected to be open to that age range. So a lot of people just wanting to get a jump on it. What's your answer to that?
Well, first of all, we always used to lie about our age and say we're younger than we really are. Now we're lying in the other direction. But assuming you're going to be 65 within a couple of weeks, you can sign on as long as you're 65 at the time of the vaccination. That's fine by me.
Okay. And that's good news for everyone who's sitting there, and they can get some help from their young ones at home if they need to figure it out. But once the vaccine is opened up to residents 65 and over, what if there are healthcare workers or people over the age of 75 who still need to get vaccinated? Maybe they waited, maybe they missed their slot. Are they given any kind of priority? Can they just jump back in and say, hey, I was supposed to go?
Well, they certainly
My
are
point of
still
view,
eligible.
the answer is yes. I mean, we want those people vaccinated. That's why they were in the very first group. They are the frontline healthcare responders. And maybe they were a little hesitant on the first round. So we want them to get vaccinated, and we'll take care of them.
And Doctor, you would agree with that?
Yes, absolutely. Now, even though we've moved on to people 75 and older, if you're a healthcare worker or that chose not to get vaccinated early, you're certainly still eligible, and we absolutely encourage you to reach out and get an appointment.
Okay, and Doctor, another question, actually to both of you. I'll have you both answer, but now to a question from a woman who called in from Hartford, and she wants to know if it's going to be a problem for Blacks and Hispanics to get a vaccine because she's concerned that not everyone has a car to get to a vaccination site. She's asking that Black and Spanish neighborhoods not be forgotten. She says, quote, "We matter too." Doctor?
Yes, absolutely. And we are working really hard with our communities in all across Connecticut to make sure that everyone has equal access to the vaccine. It's very important. It's a priority of the governors. And we're working hard on our strategies to get vaccine out to make sure that that's a reality. We've got local health departments, we've got providers, we've got community organizations religious organizations, and community leaders, all of whom are working with us to help us make sure that we are getting a vaccine to where it's needed.
And Governor, I know this has been a concern for you too, like the testing. We did talk about it's a little bit difficult sometimes to reach certain neighborhoods. So what is the plan?
Look, the plan is that if we can't get you to come to get the vaccine, we're going to come to you to give you the vaccine. We've got leading advocates from all the different communities, including the African American, Hispanic communities, ministers, doctors, saying why it's so important that you get vaccinated, what that means for your entire community and your own health.
And now one more question about vaccine access. Nancy is not just homebound, but she really can't leave her bed. And maybe this applies to what you just said, Governor. She wants to know if there's a chance an agency will deliver the vaccine to a person in their home if they can't go.
Deirdre, do you want to take that?
Sure. Yes, we've been working with our vaccine providers to make sure that individuals who are unable to travel have access to vaccine. So I would encourage the individual who reached out to speak to her caregiver or her regular provider of care, and we'll be able to figure out a way to have that vaccine brought to her.
Good to know. We're going to take a quick break, just about 45 seconds. And when we come back, we're going to talk about those second doses. And should you get the vaccine if you've already had COVID? That and more of your questions answered right after this.